Hi, I'm Sophie, and this is my presentation on promoting healthy aging, independence, and quality of life. All of the resources I'm going to talk about are coming out of Dearborn County, Indiana. This is where I live, and it's also where I work, so I want to be able to pass these resources on to my patients if and when I can. Just a few things that I pulled from the book before I get started. Older adults are more at risk for obesity and malnutrition. Depression and suicide are more prevalent in the older generations, and 1 in 3 men and 1 in every 2 women over 75 do not participate in physical activity when the recommended amount of activity every day is 30 minutes or at least 10,000 steps. Some things to do in Dearborn County to promote physical wellness. There's Planet Fitness in Lawrenceburg, which I see a lot of older people using. The community center in Aurora is open to everybody. There's also another community center in Lawrenceburg that's open to anybody. The Dearborn County walking trail that starts in Lawrenceburg and ends in Aurora, that is pretty lengthy, and I see a lot of people using that. And then the Sugar Ridge Golf Club, which is also really popular. There's more parks and walking trails in Hidden Valley as well, all over Dearborn County. Some nutrition services I found that service Dearborn County: the Senior Nutrition Activity Center, which helps older adults kind of pick out and have a healthy diet. The Aurora Clearinghouse, which is where I've been volunteering for a different class, that's open to anybody, but the majority of the people that I see there are older. They can come in, it's in the basement of a church in Lawrenceburg, and they can pick out what kinds of foods they want for the week. Home delivered meals is exactly what it sounds like. They cater meals to your home and help you find a nutritious diet. And medically tailored meals is kind of the same idea. This is not Indiana specific. This covers every state but Hawaii, so people in Dearborn County can utilize this as well. Housing options in Dearborn County. There's a public housing program that can help you find affordable housing, income-based housing. The Harborview and Edenburg apartments are senior specific, so only seniors can live there, which I think is nice. And the obvious assisted living and the SNF for extra help that's needed. CMHC is a large statewide facility for mental health. We see this pretty often in the hospital. It's not just one group. It has a bunch of different subgroups within it, and it covers from kids to adults. It has multiple different little subgroups within it, and there's 24 in the state of Indiana. And then Regional Health Systems Mental Health Counseling Service is an online group open to anybody for additional resources. Preventative screenings are important. I tried to pick the ones most prevalent in older adults. So Medicare offers a Welcome to Medicare exam, annual wellness visits, breast cancer, prostate cancer, colon cancer screenings, diabetes screenings, nutrition counseling, cardiovascular disease screenings, and glaucoma screenings. There are more. These ones I just think are more useful in the older adult. The program I decided to research was the Greenhouse Project. This is essentially promoting extra gardening and plants in residential spaces. There was a study done using many different nursing homes and group home facilities during COVID that showed around 40,000 deaths of residents and workers. And 3 months after the implementation of the Greenhouse Project, those group homes total deaths went down to 4 during that time, which is pretty substantial. As nurses, we have a platform that we can use to promote things like this. We can take it to the county board and try to get the ball rolling on stuff like this. Aside from having a platform to advocate, having a better understanding of community needs improves the healthcare to community relationship, and the ability to educate our patients in the community about healthy living gives us the ability to refer to the resources I was talking about when needed. In my presentation, I went over resources for housing, food supply, and mental health. I also touched on Medicare preventative care and the positive results of the greenhouse effect. We also kind of went over how, as nurses, we have a platform to be able to advocate for similar projects that will promote community health. These are the references I used. Thank you so much for listening.